Hello and welcome to 72 Dragons. Today, we have the pleasure of speaking with Jessica Zamora. Welcome to this interview, Jessica Zamora. It is an honor and a pleasure to have you with us today.
Thank you, Pietro. Thank you for the opportunity.
Jessica Zamora is a dedicated professional in the field of public health with a background and strong commitment to making a positive impact in the community. Her experience ranges from managing sexual health programs to conducting research on public health interventions. She is an inspiring personality who empowers and motivates people to join the field of public health and make a difference. My name is Pietro Aparicio from 72 Dragons, and thank you again, Jessica, for sharing your experiences with us. Without any further ado, let's begin. What are the most significant takeaways from your Master of Public Health program at the University of Illinois, Chicago? How have this experience influenced your career?
Yeah, thank you so much, Pietro. One of the biggest takeaways from a master's degree program is that I was able to introduce a sex-positive messaging campaign at the clinic that I was working at the time. I was coordinating 2 different care coordination programs at the clinic where I was working very closely with a multidisciplinary team, doctors, nurses, case managers, and we were working together to have clients who we haven't seen in a while come back to the clinic and get back to care because we hadn't seen them for over 8 months. So they were considered what we call lost to care. And one of the things that we often heard time and time again is that they were afraid to come through our doors because they were going to bump into somebody that they may know and why they're going to the clinic for. And so there's a lot of stigma that is associated with HIV testing and HIV care. And my mission with this campaign is to address the stigma that continue to persist in our communities. And undetectable equals untransmittable, or U equals U, is a concept where for a person who's living with HIV is taking their medication, if they have less than 40 copies of the virus in their system, then they don't have enough to transmit to their partners. So I made it my mission to make this information readily accessible to our patients at the clinic. There was a lot of workshops that were conducted in English and Spanish. There were flyers. And one of the things that really just warmed my heart is when I had a patient pull me aside and they showed me the flyer that I had put together. And they said, I carry this with me everywhere. And it is a reminder for me to take my medications. And it has made a tremendous difference in my marriage. And I no longer live in fear.
Definitely a very rewarding work. What inspired you to manage a national sexual health at-home testing program at the National Coalition for STD Directors? Could you provide insights into your role and the initiatives you're leading?
Yeah, of course. So I'm a senior manager for our at-home testing initiatives called Check Yourself. And it's a program that is designed by, for, and in partnership with health departments. And so I work with local state health departments across the country, including nonprofit organizations, clinics, and other health serving entities. And I work very closely with a partnered lab to distribute the test kits to these respective health departments and clinics. And so what really inspired me to go into this area of public health, specifically at-home testing, is when COVID-19 hit. Prior to this role, I used to manage a walk-in STI clinic here in Chicago, and there was a lot of staff redeployment. There were staff shortages, and that really impacted the direct patient care that we can provide. And oftentimes our slots will fill in very early in the morning. I'll have to ask clients to come in later in the day or the following day, and they don't always have the capacity to come in another time for care, whether it's because of their job or some other factor. And so with at-home testing, I sought this as an opportunity to provide a service that is readily accessible, it's convenient, and does not tie a patient to clinical hours. And it sort of just creates a sense of autonomy for the patient, and empowerment to conduct their own testing. But it also normalizes routine testing. And I want to see routine testing for STIs the way that we would do normal routine testing for COVID-19 if we think that we've been exposed. And so that is the concept and a future direction that I see with sexual health testing. And my hope is that we can conduct more targeted outreach and really provide a service to those who need it the most.
Thank you for sharing. That's a fantastic way to facilitate this testing for people who need it. Now, you're also a writer. Your contribution to the today's Inspire Young Latina Volume 2 book series is commendable. How have people responded to your story? And is there any special feedback or reaction you have received?
Yeah, I've received very positive feedback on the chapter for the book. And one of the things, really my mission with my chapter is to really debunk a lot of the misconceptions and myths that surround HIV and other STIs that persist in our communities. It's become such a taboo topic of conversation. And what I want the viewer, or not the viewer, but the reader to take away is that sexual health is honestly overall health. And it's really important that for those that may not be familiar with the chronic condition, understand some of the common barriers and challenges that a person that's living with the condition is undergoing, and change their perceptions surrounding HIV and other STIs. And that was a huge win for me, because early on in my career, there was a lot of pushback from my family. They weren't happy. Actually, they were very much concerned about me working in this line of work in public health. And after reading my chapter, it really changed them. It really made them think of HIV in a different light. And I'm just happy that I was able to accomplish that.
Great. Yes, it's a very challenging work. Now, you are a member of the Latino Caucus for Public Health. Can you tell us more about your role as the treasurer of the Latino Caucus for Public Health and the initiatives you are involved in? How do you hope your work with the caucus will impact others?
Absolutely. So as incoming treasurer, I'm overseeing the funds that are funneling through our organization and ensuring that the funds that we are receiving are supporting some of the initiatives that we have through our organization. And so one of the things currently that we've been working on very proactively is seeking sponsorships to support some of the great activities that we're going to have for our 50th anniversary in Atlanta, which is very exciting and a huge accomplishment for the caucus. But also where we're actively seeking sponsorship and trying to gain further support is for the student fund. And for the student fund, we really aim to help graduates, undergraduate students to continue their education, but also expose them to opportunities for professional development. So there's just a huge opportunity for students to connect with seasoned professionals at APHA and other high volume events that they can really build their network and really learn from the professionals in the field who are doing the work and can serve as a mentor for students. So my hope is that we can continue the work for the Student Fund and continue to make that impact for our Latino students who are trying to get their footing into the public health field.
Latino Caucus has a very important role, I understand, at the APHA and also particularly in the Hispanic Latino community. What are your future goals and aspirations in the field of public health, and how do you plan to continue making a positive impact on public health initiatives?
I think I've been kind of going back and forth on this, but I really aspire to eventually go into global health and do some of the work on HIV prevention, STI prevention on a more global scale. I'm very thankful to have started my career in the community level, because a lot of the experience, a lot of the stories that I heard by working directly with the client, I have been able to apply that information and create successful interventions to connect with the populations that we're serving, along with the health departments that we're partnered with. And so my hope is to continue that line of work and making that impact in the field on a global scale. And I would like to hopefully, with the work with the at-home testing in my current role, is that we're going to utilize that data to mobilize policy, and hopefully that can help us create more funding streams to support at-home testing initiatives.
Wonderful. Great opportunities for your future, especially in global health, and there's a great need for sexual programs, and testing it's a big part of that. Jessica Zamora, thank you for sharing your journey and for being an inspiration to many. Thank you for sharing.
Thank you.